can see a few people are starting to join. We'll just give people a few more minutes. It's 6:59, so just give everyone a minute here to join. Okay, welcome everybody. This is the last webinar in our series of everything you need to know about breeding your mare. Thank you everyone for joining us. If you missed the other ones, they are available still on our YouTube page and on our website, so you can catch up on them there. And for now, also don't forget we've got the live Q&A afterwards as well. So any questions you have, just pop them in the chat box below and Dr. Gomez will answer them for you at the end. So I will pass it on now to Dr. Rafael Gomez. There he is.
Hello. Hello, everyone. Thank you for joining us. Let me share my screen and we'll get started. Okay, here we go. Perfect. Can you see okay? Perfect. Thank you very much. Thank you very much for joining us in this last episode of our webinar series. So today, to wrap up everything that we've been talking about, we're going to talk about foaling. So probably the most exciting part of the breeding process. Yeah, we're kind of like similar to the pregnancy check, but it's really, really exciting. We all love the babies. We all love to see a mare foaling. So it's a pretty interesting topic. There's a lot of information, so I try to summarize the most important parts about foaling. So here's an overview of the topics that I'm going to try to cover today. So we're going to talk about the stages of parturition, the newborn assessment, the examination of the placenta, and at the end, I just put a list of an owner's foaling kit. That is just some things that if you're going to foal out your mares, they're handy to have around. So before we start with the stages of foaling, let's talk a little bit about pregnancy, and this could be another webinar, another talk for another day. It's just like it's a big topic, but I try to summarize like the most important dates that we can see during pregnancy. So as we talk about in the embryo transfer webinar, embryos come down of the oviduct on day 6. So it's an important day. They come down to the uterus on day 6. Notice that I have embryos in capital letters. That's because they are called embryos from that moment until day 40. Once it's day 40, we start calling them fetus. I'll tell you why. Then we have from days 11 to 15, that embryo, like that embryonic vesicle, is going to be migrating through the uterine horns, through the whole uterine body, just to help the mom know that she's pregnant. So we're going to have that maternal recognition of pregnancy between those days. And those are the days that we can do the first pregnancy check when we inseminated our mares or we breathed them. On day 16, that embryo stops moving, stops that migration, and it gets stuck actually in either one of the uterine horns. After that, around day 20, it loses the capsule, and on day 21, you can actually see the heartbeat. It's hard to see it on the ultrasound. You can, but it's sometimes hard. That's why we prefer to do checks on day 25 or maybe day 30. It's easier to look at the heartbeat then. On day 35, we have the endometrial cups. These are cells that come from the trophoblastic cells that come from the embryo. They migrate to the uterus, and what these endometrial cups are going to do is basically an insurance for that pregnancy. It's going to be stimulating the ovaries, so the mare can have multiple accessory or secondary corpus luteum and producing a lot of progesterone. So day 40, now it's called a fetus. Why? Because you have the umbilical cord. Now you have it, it's complete. You start having fetal activity like head nods, and you have all of the organs of the fetus now. From day 60 to day 90, you can sex the baby, depending on the position, but you can sex the baby. And also another thing, on day 75, it starts the regression of those endometrial cups. Then we have day 120. That's when the placenta starts producing progesterone, and it's what's going to keep that pregnancy through the rest of the days that mare has. So at the beginning, the first 100 days, it's going to be the progesterone production is going to be in charge of the CLs, the corpus luteum. After the day 120, it's all the placenta. At day 150, we like to do a check just to confirm pregnancy, to check for accessory corpus luteum 2. And then to give, this is very important, the first EHV herpes virus 1 vaccine, the pneumobord vaccine. So it's going to be on day 150, 215, and 270. That is basically 5, 7, and 9 months of pregnancy. Then by day 300, we just do a late-term fetal well-being assessment, where we check the heartbeat, where we check the position, that it has to be in presentation cranial. So the head facing outside, like the head looking out of the mare, like closer to the cervix. I have a picture later on and how they have to be. And we do the pre-foaling vaccines. Usually it's just the core vaccines, flu, rhino, EWT. And also on day 300, and you can start even in day 270, but we start measuring the CTUP, that is the combined thickness of the uterus and the placenta. This is a very important measurement because it's what's going to tell us if there's a slight problem with that mare, with that placenta, if there is any placentitis. So we measure that in these days. And then foaling will occur in between 320 and 355 days of pregnancy. That's kind of like the range that we have for a normal pregnancy. So that's the whole pregnancy. So what do we need to prepare for foaling before we get into that? Ideally, we need a stall that is more or less 3.5 by 5 meters. So it's a big stall. We're gonna need straw bedding. We don't like the shavings or the dust because it has a major ability of harvesting pathogens, and also it's a little bit harder to clean from the baby. You're gonna have to look out for the other development on the mare that starts 2 to 4 weeks prior foaling. It's important to remove and to make sure that your mare doesn't have a caslix. If it's a new mare to you, just check. If you know that the mare has a caslix, well, we have to remove it 1 to 2 weeks prior to the foaling date. Then we're gonna have the waxing, and this is something that it's important, and it's kind of like one of the things that helps us predict when our mares are going to fall. And it's going to happen in between 24 to 72 hours before parturition. Then one of the things that I think it's very important, and I think it's crucial, is to give our mares a bath. So what I like to do is 2 weeks prior to the foaling date, I give them a complete bath, all of them. And then as they are getting closer, and say if they started waxing, I like to wash all the perineum, the stifles, and the caudal part of the abdomen. All of these areas are areas that the foal might start leaking while he's looking for the other. When they get up and they try to nurse at the beginning, they're going to start looking everything with the mouth and start leaking. So you want that those areas to be really, really clean. The first way that our foals can get infected is via the mouth. So it's very important that they are clean. Some older mares, multipurpose mares, they're gonna have ventral edema, so just edema in the abdomen, the ventral abdomen. And with maidens, it's important to notice that they may not develop udder prior to their first foaling. So it might be a little deceiving. One question that I get sometimes, well, basically a lot, is the prediction of foaling. So basically there are two methods that we measure at the moment, and I think are the most reliable. And one is the pH, and the other one is measuring calcium in the milk secretions of the mare. So if you're planning on foaling your mare, you can check those two measures. I mean, pH, when it goes down lower than 6, it means that it's getting closer, around 24 to 48 hours. Calcium, when it's higher than 200, it's getting close. So what I recommend is use both of them, and then you'll have a better estimate. Of course, mares like to do everything complicated, and a lot of mares don't respond to these, or they don't care about the measurements, because I've had mares that they have a pH of less than 6, and you're like, okay, they're gonna foal, and they don't foal until like 3 days after or 4 days after, and it's like, why are you doing this? But that can happen. Don't get discouraged by it. I mean, every mare it's different, but I think it's a good thing to have, and that you can measure that. So here we have the wax that forms in the udder of the mares. Let me put just a placer. Yeah, here we have the wax. So this mare, and as I was telling, I remember her like clearly. As I said, waxing is between 24 to 72 hours. She foaled out 4 days after she was waxed. So that happens. Now, we're going to talk a little bit about the stages of foaling and how to recognize them. There are 3 stages. So the first one is going to be the field positioning and the preparation of parturition. This is probably the hardest to differentiate or to notice, because it lasts from 1 to 4 hours. And a lot of times, and if you guys have ever been foaling out mares, or you have your own mares, you know that some mares get uncomfortable in the last month when the baby is moving, and it starts getting into position, and they might get colicky sometimes. But with this one, they actually started having myometrial activity, meaning they have contractions, and this is going to help the fetus get into the position for foaling. These contractions are going to give her a colicky behavior. So any signs of colic, like looking at her flanks, they can even self-mutilate. They can start biting themselves. They can be squatting. They can be sweating. They start tail switching. They start being really, really uncomfortable. They can lay down and they stand up. But it's important that you notice that the mare is doing that, and that she's doing it constantly. So as I said, it can last from 1 to 4 hours. So basically, just be aware of that. And when you're doing night check, just focus on these signs. They can also do phlegm response, like they do when they are in heat, or like the stallion does when they're in heat. It's basically when they with the upper lip, they start showing kind of like the teeth, and they let it's basically to let the pheromones pass to the vomer organ in the nose. That's what the stallion does. Mares, I think they do it just because they're uncomfortable, but you can notice that. And this stage is going to end when the water breaks, and it's basically the rupture of the chorioallantoic membrane. And that chorioallantoic membrane, it's the placenta. So here I have a video. Let me click on it. So I had my pointer. Visible. Here I have a video of a mare that was about to foal. I don't know if you can hear it, but she's kind of like in pain, in distress. it was very dark at night. Mares like to foal when it's quiet. So it's usually in the middle of the night. I hope you heard, because that was like the video is very like, when you hear it, you can hear her like groan like. So this is the position that we're looking in our fetus, and this position is going to be basically from day 300 until they fall out. But you can see that it's craniocaudal basically to the mare. This is the cervix. This is that chorioallantoic membrane. This is the amniotic sac, the one that is close to the baby. And you can see how the legs are positioned. So stage 2, it's gonna be fetal expulsion. So this is a very quick stage, and it's a very quick process. It lasts from 10 to 20 minutes. After 20 minutes, if nothing is it's happening, if the water already broke and you're not seeing feed, nose, or any sign of the foal, something's wrong and you need to call the vet. And it's 20 minutes. So I think it's very important that we set a timer. Once the water broke, you most likely will see a little part of that amnion on the outside of the mare. And you start counting 20 minutes. You have 20 minutes. So presentation, it's gonna be anterior. You wanna have the hooves, and the head is gonna be resting in between those hooves. So what can we see coming out of our mares? It could be just one hoof, it could be a hoof and a nose, it could be two hooves, and they're usually inside this transparent membrane that it's the amnion. Once they fall out, this stage finishes once the foal is completely outside. And you will notice that the umbilical cord will be still attached to the mare. Don't break it. It has to break naturally in most cases, like in the vast majority. And it will break once the mom stands up. I read an article that said that in that moment, after parturition, when the mare kind of like breathes and rests a little bit, and the foal starts getting in sternal position and starts figuring out life, they can still be a pass of even up to a liter of blood through that umbilical cord. So it's better to leave it there. If it doesn't break, then we have to break it. And that's why we use umbilical clamps. So we can clamp that like 5 centimeters from the abdomen of the baby. We clamp that umbilical cord, and then we can cut the rest, the one that is attached to the mare, or we can rip it. Actually, if you don't have a clamp, you can use like an umbilical cord, they are called, to seal that, and then you can hold one extreme of the umbilical cord and with the other one, and you can just rip it. This traction movement will actually stimulate that umbilicals to create a clot and to stop that blood flow. And it's basically the same motion that happens when the mare stands up. Just don't pull it away from the baby. You have to grab both sides so you're not tearing it apart from the baby, because that could cause some other problems like urachus or infections or something like that, umbilical hernias too. So that's this is what we're gonna see at the beginning of stage 2. So here we have the amnion, and then we have a little hoof just peeking right there. So that's what we're looking for at the beginning of stage 2. This is the positioning of the fetus during parturition. This is a graphic that I just love. It was done by Dr. Ginther, O.J. Ginther, in 1998. He did like this beautiful paper where he describes pregnancy and a little bit of foaling, and it's just, I love it. I get really excited about it. But we're basically looking at the baby from the top of the mare. So here we have the vulva. Let me put my point interruptions. Here we're gonna have the vulva. These little clocks will tell us the dorsal part of the uterus, like just the uterus, not the mare. This is the dorsal part of the uterus. Fetal withers, the withers are going to be in green, and the tailhead is going to be in red. So we can see here that both of them are ventrally in this image. Here they stay ventrally, and we can start seeing that the foal starts extending the front limbs. Then the foal is going to turn around. So the withers go to around 3 o'clock, tailhead stays the same. And then what's going to happen, and that is very interesting, it's actually the uterus that is going to rotate along with the baby. So here we're going to have the dorsal aspect of that uterus. So the uterus will do these two, allowing the baby to come out like this, like we see them. One hoof first, nose in between, the other hoof follows. And at the end, the baby is just going to stretch the hind legs. And this is just the tail, not the tail, the tip of the horn that the hind feet were there. But this is basically the process, and this is going to happen within 20 minutes. So now we're going to have stage 3. And what is stage 3 is the expulsion of the fetal membranes. We call them fetal membranes because it includes the placenta, the choriolantoid, and the amnion. So we're going to have the placental detachment and expulsion. We're going to have myometrial contraction. So our mares can be uncomfortable again. They can sweat a little bit. They can show a little bit of discomfort. Might not get that colicky behavior like they can with foaling, but they can be a little uncomfortable too. And it should be expelled within 3 hours. If your mare still has the placenta after 3 hours, that's a retained placenta, and that's an emergency. It's not, mares are not as resistant as cows with this problem. So this is like an actual emergency. If you leave the placenta, that tissue starts to die, it starts necrotizing, and it starts secreting endotoxin and bacteria, and then you can have a really, really bad problem with your mare. So here's this is another chart that was designed by Dr. Party on 2006, and it's just an amazing way to put it. It's basically a stoplight, and it includes what needs to happen and the times for stage 1, stage 2, and stage 3. So here we have stage 1, as I said, 1 to 4 hours. It's normal. If it's more than that, it's concerning. If it's more than that, it's abnormal. Same for the stage 2, 10 to 20 minutes. As I said, after 20 minutes, if it's been 20 minutes and nothing has come out yet, you have to call the vet. 20 to 30 minutes is concerning. More than 30 minutes, it's abnormal, and it's also an emergency. And same for the expulsion of the placenta. After 3 hours, it's gonna consider retained placenta abnormal. But after 6 hours of that happen, it could be a problem, and it is concerning. Your mare is in danger. So this is a very handy thing to have and to have in mind. And that's why I, like at the beginning of the talk, I was telling, like, have a stopwatch, have a clock, or be mindful of the times. They are very, very important. So now we're moving on to the newborn assessment. Our mare foaled out, everything was fine, everything was in time. She already has a placenta or whatever, she's in process. What do we do with that baby now? So this is like the main signs that we're going to look at. Baby needs to be in sternal position, sternal meaning this position, laying down over the sternum, from 1 to 2 minutes after foaling. So it's pretty quick. They're going to start having suckling reflex after 20 minutes. If you're gonna check for the suckling reflex, please use clean gloves, because the first via of that a pathogen can get into our foals is via the mouth. So you can check on that. Our babies need to stand in the first to 2 hours, and they need to nurse in the first 2 to 4 hours. I always say in the first 3 hours, to nurse. If it has been more than 3 hours, I think you need to call the vet, and you need to make sure that you get colostrum into that foal before 6 hours. Meconium should pass in within the first 3 to 4 hours of life, and urination, that's a tough one to see and to be aware of, but it could happen anywhere in between the first day that foal is born. What are we have to look out for for urination? I mean, it's important that we see it, that they are urinating from the right spot, and that there are no urine coming from the umbilicus. That's very important. Yep, those are basically our baselines on the foals. After that, I always recommend having your vet check them, do a newborn assessment, so we can see all of the other like some other stuff. One other thing that I think it's important that you check on your baby as you're touching them, always check the rib cage. It should be like smooth, and you don't have to feel any like divots, because sometimes they could get rib fractures from foaling. So what are we looking for when we're foaling our mares? Sorry, let me put my pointer here. Good and strong suckling reflex, that they are drinking, that they are passing that milk, that they can swallow it, that there's no milk in the nostrils. So this is basically our goal. When we see this, we are happy. We're very, very, very happy. So another stoplight, same with the times, same with the times. Now it's for the baby. So here in green, we have what's normal, yellow concerning, red completely abnormal. So sitting in sternal before 5 minutes, you are fine. It should be fine. It usually happens in within the first 2 minutes, but if it's been 5 minutes and he's sitting in sternal, that's perfect. After this time, you start being concerned. The suck reflex in the first 5 to 10 minutes, even 20 minutes. Time to stand, the first hour, concerning 1 to 2 hours, more than 2 hours is definitely abnormal. And time to nurse, 0 to 2 hours, 3 to 4 hours is concerning, more than 4 hours is abnormal. I can say that there are some foals that are slower than other ones. So there are some foals that will stand in between these 1 to 2 hours, but then they go and they nurse perfectly in within like within 3 hours. So for me, it's a 1 to 3 rule, where by 1 hour they should be standing, 2 hours they should be kind of nursing. By the 3rd hour, they should be for sure nursing, maybe passing meconium, and by the 3rd hour, the mare needs to be already done passing that placenta. The placenta needs to be out. So now here's a very useful score. It's called the Apgar score for our babies. And it's very simple. This is a very simple chart that we can follow. It's better when you do it in the first 3 minutes of life. So it's usually going to be if you're following your mare, before the vet can get there, you can check on these and you can do this score. So you can score depending on the signs. You score from 0 to 2. So what are we going to check? The heart rate. How are we going to check her? It's good if you have an stethoscope in your foaling kit, but if you don't have one, the thoracic cavity of the foals, it's very thin. So if you put your hand in the chest of that foal, like underneath the left, or even the right, but the left shoulder, you're gonna feel that heartbeat. So how are we gonna grade it? If it's less than 60 or more than 60 or undetectable. More than 60, it's normal. Less than 60 is it's abnormal, you get a 1. Undetectable, you get a 0. Then the respiratory rate. Regular, when they were born, it has to be more than 60. After, I think it's 5 to 10 minutes, that respiratory rate will lower down a little bit, and it can go from 30 to 60. But you just have to see that it's like, and that is a strong, respiratory rate, that they can insufflate their lungs, and that it's regular. And a slow, irregular respiratory rate means that something is not quite right. The muscle tone, if they limp, if they are in extremity flexion, basically when they're just laying down, lateral recumbency, and all of the extremities are flexed, that's not normal for a newborn. What's normal is for them to be in sternal, as we said before. And then nasal stimulation. So you're just going to put a finger in the nose, and we're aiming to see a response, a sneeze, rejection. I mean, they get like very angry when you're trying to poke their nose. So that's what you're looking for. So once you've scored these 4 things, if you have a 7 or an 8, your fold is it's normal. If you have a 4 to 6, the score is going to be moderately depressed. If it's 1 or 4, markedly depressed. And obviously, if it's 0, the fold is death. On the physical exam, I just wrote here like the physical parameters, normal physical parameters for a foal. And this is after an hour or 2 hours that it's been born. So heart rate is going to go from 80 to 120 beats per minute, heart rate 30 to 60 respiration per minute, and the temp can vary from 37.5 till 39 Celsius. One other important thing that we have to evaluate when we're looking at the foal, like the first, first evaluating at the foal, those first minutes, is if it's premature, if we don't have the foaling dates right, if it's premature, characteristics from a premature foal are going to be droopy ears. They're going to be flaccid. The muscles and the limbs are going to be flaccid also. And they're going to have silky hair coat, like very, very silky. And they can have like a doomed forehead. Those are signs of prematures. So if a foal is born in less than 320 days, it's considered a premature foal. Post-term foals, it could be common in maidens and older mares, older multiparous mares. There are mares that can go over a year and it could be normal. The foal could be a little bit bigger and it could be born with the incisors, but they are usually fine. And at this mature foal, this is a very interesting, because it's a foal that suffered a retardation on development, but it was foaled out in a normal gestational period. Not period or age. So it's a foal that was born in between 320 and 350 days, but it has premature characteristics. So the silky hair coat, the doomed head, forehead, the floppy ears, laxity in the muscles, and they are very weak. So those foals usually need intensive care in a hospital. So that's another thing that is very important that we are evaluating when we're first seeing our foals. Now we're going to move to a very important part. After we check the foal, mare fold out great, foal is doing great. Apgar score of 8 and is looking good. It already stand up, it already nursed. So we're happy with our foal. Now the mare has passed the placenta in those 3 hours. So what do we do with that placenta? So first we need to wash it and take all the debris out, like all the bedding and stuff that can get. And then we're going to evaluate it. So what are we evaluating in the placenta? So the placenta is made from 2 different tissues, and it's called the allantochorion. That's how it's named. And it's basically, we have a chorionic part and an allantoic part. The chorionic part is the one that is in contact with the uterus. So it's going to have a red velvet appearance. It can be sometimes a little brownish, and that can be considered normal. And then the allantoic part is the part that is in contact with the baby. So it's going to be kind of purplish. It's going to be smooth, and it will have a lot of blood vessels that will, those are the placental arteries and veins. Then we also have the allantoamnion. That's that thin white layer that is covering our foal, and it's the first thing that we see in stage 2 of labor. So we're going to evaluate that too. What are we evaluating in each of these? On the chorionic part, and I'll show you in the next slide. But basically, we're evaluating colors and changes in appearance. So in the chorion, any change on that red velvet appearance, it has to look like Velcro. So if it looks smooth and pale and kind of fibrotic, that's not normal. That's an area that wasn't attached to the uterus. If it looks like really like brownish and it's kind of like thick, that's also abnormal. On the allantoamnion, on the white membrane, we sometimes forget about it, but it has to be kind of like thin and a little maybe transparent. It has to be uniform, and it doesn't have to have edema. So like kind of like pockets of fluid in it. And then another thing that we're going to evaluate is the cervical star. What is the cervical star? It's the part of the placenta that is in contact with the internal os of the cervix. So it's important that we identify this cervical star. How are we going to identify it? It's an area that has several just lines of that fibrotic appearance that is going to be white, and it won't have the velvet appearance. Why is that? Because it's the cervix. It's the part of the cervix that it's here, that it's not in touch with the uterus. So this area of the cervix has some folds, and those folds are not in touch with that placenta, and that's why we have those lines. It's important that we check that the placenta ruptured from there, because that means that it was normal. So it's usually the part where it's ruptured. So it's important to check the cervical star. Then another thing that we can have is the hypomane, and this is just epithelial debris and some calcium and phosphate deposits. It's just a weird kind of like sponge things that comes out from the mares, and it varies in sizes and weights, but it's just that. Don't worry about the hypomane. We're gonna check the umbilical cord. It's normal when they fall out if it has some bruises, but we don't want to see any clots or any signs of torsion. And then one thing that is very important when we're evaluating the placenta is the weight of that placenta. It's very important that we weight it, because it's a very important and a crucial part of information when we are dealing with a foal or with a high-risk pregnancy, or with a foal that you don't know if it's doing quite right. So when you weigh the placenta, it should weigh more or less and approximately 11% of the foal's body weight. So if you fall out and the foal weighs 40 kilograms, the placenta should weigh 4 kilograms. How do we weight it? We put everything in a bag. Allantoamnion and the allantochorionic part with the umbilical cord, like everything. So I think that's very important to measure in our mares. So here we have different placentas. Let me put my laser again. So this is the allantoic part. So as you see, it's purple. We see blood vessels. It's very smooth. It's kind of thin. This is the chorionic part. You see that it's red. You see that we have darker areas. Those are normal. What are we going to do when we evaluate? We need to find the cervical star first. So is this area. This area is going to be the cervical star. And then we need to look for the pregnant and the non-pregnant horn. And we like to position it in an F position. I mean, well, this is a backward F, but still an F. So how are we going to identify the pregnant horn from the non-pregnant horn? The pregnant horn is going to be smooth. It's going to be thick in the tip. It's going to have a little bit of edema here, and that's completely normal. You can see it here. You can see it here. And the non-pregnant horn is going to be wrinkly. It's going to be thinner. It won't have any edema, and it kind of looks bigger. It's easy. It's kind of easy to mislead or to be mistaken with the non-pregnant, because it kind of looks bigger, and you're like, oh, well, that was the baby. But no, it's thinner and it's kind of wrinkly. This is the one that is very important, and this is the one that is going to matter, because this tip is the one that likes to get stuck inside our mares. So it's very important that we check that all the placenta is it's complete. So here we have it. Here's the chorion, and here we have an example of a placenta that it's really, this is like, this placenta has a lot of changes, like very maroon, and it was smelly, and I mean, you can see that it's not the best placenta, and you can also see where the non-pregnant horn is torn. So this non-pregnant, like this tip of this horn was still inside the mare, and that's also a medical emergency with the mares. Yeah, so now that we cover everything, I put on a list of the foaling kit, like what are good things to have if you're foaling your mare. So the first thing to have in your foaling kit, and this could be like redundant when we have the cell phones and we have everything available, but the vet's number, I think it's a good thing to have just stuck to that. If you have everything in a box, just have it stuck there, because while you're looking for the number in your phone or whatever, I think sometimes it's easier just to dial it, and it's something handy to have. An stethoscope or a thermometer, if you have some, it's very important. Examination gloves. Do everything you are going to do with the foal, you need to wear gloves. You don't want to contaminate anything, so wear gloves. If you're going to start handling and manipulating that foal, wear gloves. Always wear gloves. The umbilical tape or the umbilical clamp, just in the rare case that when the mare stands up, the umbilical cord doesn't break, so you can do it. The navel disinfectant, I personally like the chlorhexidine. It's just a diluted solution of a 0.5% of chlorhexidine. You can also use povidone iodine, I think it's, or betadine solution, a 1% solution. Towels to clean the foal when they are born. Sometimes that amnion gets stuck in their face, so just clean that from their nostrils so they can breathe freely. A tail wrap, and this, I think it's important to have it prior foaling. So when you're preparing your mare to foal out, when you see that she's getting close, you wrap the tail, because when they are born and they expel all that allantoic fluid, they get really dirty, and it's another source of pathogens and dirt to get in our foals. If we have it wrapped, it's better and it's cleaner for our foals, because they're gonna start leaking everything, like seriously everything. A colostrum refractometer, and I'm gonna talk about these a little bit in the next slide, but basically what it does is measure the quality of your colostrum, and that's, I think, very, very important to have if you're breeding your mares. A trash bag and a scale to weigh the placenta. An enema, there are some places that routinely just do an enema on a foal after some hours after he's been born, if he hasn't passed any meconium, just to prevent any meconium impaction. If you have one that is one of the phosphate enemas, just have one. You can create very bad electrolyte and mineral imbalances in the foals if you put more than one, because the colon has a very good capacity of absorbing nutrients still. So be careful with these ones, but it's something that it's handy to have in hand. it's handy to have around. Again. Scissors in case of a red bag. I don't know if you're familiarized with this term, but the red bag is when we have a premature separation of the placenta, and that part of the placenta starts protruding from the vulva of the mare, so the water never breaks. And once that placenta is detached from the uterus, the oxygen flow and the blood flow to the baby is going to decrease. So it is an emergency, and sometimes if you're foaling your mares, the bed won't be there, and if you see a red bag, you need to cut it. And you need to take and see how the baby is, and if you can start pulling it. A flashlight, because they like to fall out at night, and a stopwatch to check the times. It's very important to check the times. It's handy to have a bottle of 250 or 500 mLs to collect colostrum. If you have several mares foaling out, it's always handy to have frozen colostrum. Obstetrical sleeves, sterile lube, and chains, wraps, handles might be included. If you have the training and you know how to use them, you can include them there. If you don't know how to use them, wait until the vet gets there so they can position it correctly, because you can really damage the foal if you don't position the chains and the handles like correctly. So these are some of the things that I think are helpful when you're foaling out, and they're handy to have around. Now, the colostrum refractometer. This is something that I really love. I really like this because it gives you another piece on that puzzle to make sure that your foal is okay. So basically what you do is you put a drop of colostrum here, close this lid, and just look at it to the light. And this is what you're going to see. What you're going to be measuring is this dividing line between the blue and the white. So what we are measuring is Briggs percentage, and this is basically the amount of light that passes in this refractometer, the amount of light that passes through the particles, and these are measuring specifically, I think, sugars and big particles like IgGs. So what this is going to tell us is if this colostrum has a good amount of immunoglobulins. IgGs. Those IgGs are going to be the ones giving our foal the protection, and this is very important to have a good passive transfer of the antibodies of these IgGs. So basically, how it works. This is an image from the ARS colostrum refractometer from Colorado. It's very good. I like it because it just tells you here poor, fair, good, or very good. You don't have to worry about the numbers. But if you have one that doesn't have these and just has the numbers, over 20 is good colostrum. More than 20 is a good colostrum. Fair from 20 to 15, less than 15, poor colostrum. So from 25 to 30, more than 30 is the colostrum that you want to freeze, that you want to save for other mares, in case you have a mare that has a 20 or a 16, or it's in between here. If you have a mare that has less than these, I would consider using frozen colostrum from another mare, and keep a close eye on that baby. It's important that the baby receives colostrum in the first 24 hours, but good colostrum, I think it's even more important that they receive it in the first 6 hours. Why is this time frame? The lining of the small intestines of the babies, it's kind of like open, so it allows the pass of big molecules, meaning the antibodies, the IgGs, things that normally wouldn't pass. So after 6 hours, they start closing. So there's literature that says that after, like, you have 24 hours for the foal to absorb that colostrum, but I always like to keep them in within those first 6 hours of life. That's why if after 3 hours your foal hasn't gotten any colostrum, I consider like calling the vet or getting milking the mare, getting into the bottle, or just calling the vet. What I do, I just pass a nasogastric tube and make sure that they receive colostrum. Protecting dose of colostrum should be colostrum. It's 1 liter. Of course, you cannot feed 1 liter to a baby. Their stomach can only hold batches of around 200 mLs, maybe 250, pushing it in a regular size foal, like a thoroughbred. So we have to be careful with that. But I think this is very handy to have when you're foaling out mares. So the take-home message, I think it was a long talk, but I think it's very important that we monitor the pregnancy. We need to make sure that everything's okay. And during the pregnancy, we can see if there's something not going right, if the mare has some placentitis or anything that we can handle and monitor. And then we need to be careful with that baby when it's born, if there was a problem during pregnancy. Be prepared with the foaling kit, with the charts, with the times. Like all of that is important that you have it in mind, or at least in your foaling kit. You can print those charts. You can print them and just put them there, so you don't have to remember everything, and you have it there. Every mare is different, so don't get frustrated. And mares like to play. They like to play with us. So every mare is different. Don't get stressed if your mare hasn't developed a lot of others. Maybe she's a maiden and she's going to drop the milk as soon as she drops the baby, or every mare is different. So know them and be patient with them. Be aware of the times. This is very important. The stoplights. The stoplights are very, very important. So like stages of foaling: 1 to 4 hours, stage 1; 10 to 20 minutes, stage 2; 3 hours, stage 3. Babies, standing 1 hour, nursing 2 hours, maybe 3 hours, 3 hours, passing the placenta, and maybe passing meconium. And know when something is not normal. You have to know when something is not right. And this is when the stopwatch comes in handy, or just being aware of the time, because you can lose track of time when you're dealing with the mare, with the stress of the situation and everything. And you could be like, no, it's not been a lot of time. It's been like 10 minutes and it's been like 30. And it's like, so you need to call the vet. And call your vet. Don't doubt to call your vet. You guys have invested a lot of money, time, effort in getting that mare pregnant and through pregnancy. So foaling, it's a crucial part. Thank God mares, they do it really well. And the percentage of mares that have complications like dystocias or stuff, it's minimum. It's kind of like 10 to 12% of all the mares. But know when to call your vet. That's very important. So I hope you liked this talk. This basically ends our cycle of these webinars that we've been doing. It's been really fun for me. So everything kind of ties up together, from the estrus cycle, how to know your mare, how to know when she's cycling, how to determine if she's cycling, if she's not, what is she doing, like hormonally inside her, why is she behaving in certain ways, what is going on in those ovaries, in that uterus, and what's your vet going to do to, maybe you have a problem mare, what are the steps to treat her, what are the options that we have with her, what could be it, right, if it's infectious or non-infectious, or what's going on with her, and what steps are we going to follow to actually breeding the mare. We talk about insemination. I mean, a little bit of natural cover, but basically insemination. If you're going to inseminate your mare with fresh, frozen, cooled semen, and to know what to expect. Once you inseminated your mare, if you're going to this area, you can do the embryo transfers. How does it work? Why do we do it? When is a donor mare candidate? Which ones are the good recipients? all of that, all of these topics that we were talking about for these months, these previous months, they all lead us to the foaling, and this is what we want to see. This is like one of the most rewarding parts of the job and of breeding horses. It's just watching them foal, watching a foal being born, stand up, nurse for the first time, taking their first steps, running for the first time, and just looking at a healthy foal. That's that's priceless. That's priceless, and I think it's very important that we have in mind everything that comes after foaling, so you guys have a better idea of what is the breeding and how do we do it, what's in your vet's mind, and just to have an open communication with your vets. I think that's always very helpful. So I hope you liked it. I really hope you liked it. You like this series. If you didn't catch any of the other talks, they are in our YouTube page, so you can consult them there. And please feel free to reach out to the office, reach out in any of our social media. There's the email. If you have any questions or any comments, if you like the webinars, if you would like us to do more of these or more quick tips like we're doing with the 3 Thursdays, please let us know. For us, it's very important to hear from you, because that helps us in helping you. That sounded very corporative. but yeah, I hope you liked it, and I'm happy to answer any questions if you have any. We can check in the Q&A. I just have to change my pointer again. There we go. Okay.
Yeah, I don't see any questions coming through yet, but we'll give people a minute just in case they're typing.
Good. Maybe that means that I explained it very well. Hopefully. Hopefully.
Definitely one that'll be a rewatch for sure.
Hopefully. If you guys don't have any questions at the moment, but you think about one, like, I don't know, at night in the middle of your dreams, you wake up and like, feel free to send it to the email or any of the social media web pages. I'll be more than happy to answer them. And as I said before, let us know if you like these.
Well, it looks like that the chat is disabled, so I'm just going to try and look at that.
Yes.
It looks good on my end. Do you see anything?
I see the question. Well, I see that one, but I see a question now. Is there any certain spot to take the heartbeat with the scope? Yes, if you had a stethoscope, is just behind the left elbow. That's where you're gonna hear the foal's heart. Remember, when you're doing it with the stethoscope, you're looking for two sounds, double loop, double loop, double loop. That is the systolic and diastolic. So two sounds is one heart, it's one beat. So double loop 1, double loop 2, double loop 3. It's a little bit harder with the foals because it goes really fast, but it's a good thing to have in mind. You're welcome.
Okay, well, I think that's everything. Oh, is there another one?
Thank you. Thank you for watching. Yeah, I think if there's no more questions, thank you very much, everyone, from joining us for joining us. Thank you, Steph.
You're very welcome. Thank you so much, Dr. Gomez. Really enjoyed these last few months with these webinars, and maybe we can do it again next year.
Me too, for sure.
Thank you, everyone.
Let us know if you liked it, guys. Thank you.